Jump. Committee will come to order, and the chair will recognize himself for an opening statement. This markup continues the committee's efforts to update government for the innovation era, boost jobs, protect the public health. We're going to consider a package of bills to modernize the FTC. We'll also consider a bill regarding amateur radio and 3 bills to improve public health. Last year, we commenced our Disruptor series, an ongoing series looking at the new technologies that will drive future job growth and innovation. We looked at the Internet of Things, the sharing economy, mobile payments, 3D printing, and we even had a drone take flight during a hearing in this room. So tomorrow, we're going to examine medical apps. We repeatedly heard that our policies are outdated and harming innovation. Our members got to work and crafted what I think is thoughtful, targeted reforms to modernize the FTC. We consolidated 11 legislative initiatives into 4 bills that we're going to vote on. With a vigilant eye on consumer protection, we have balanced our FTC updates with the need for consumer protection, and we focused on transparency and balance. We also have solutions to restore fairness to online consumer reviews, protect consumers' rights to buy tickets to their favorite events, and strengthening Made in USA labeling. I would note that the Consumer Review Fairness Act, a major priority for our Internet economy, enjoys bipartisan co-sponsorship. When someone is getting ready to travel to Southwest Michigan, they need to have confidence that the reviews that they're reading are true, because there's not a better place to go. And I want them to know what a wonderful place my entire state is, not because someone has tinkered with the reviews, but because it really is, especially this time of year, right on the lake. We're also going to consider a bill to protect the rights of amateur radio operators. Just as the law recognizes that access to broadcast satellite communications are an important part of our national information infrastructure, so too should we recognize the role of amateur radio. Especially important, as amateur radio operators can serve a crucial role in providing communications in the wake of natural disasters and other times when commercial communication networks might be unavailable. On the health front, we've had good success in getting important public health solutions across the finish line. We look to build upon our success as we consider 3 more bills. The Sports Medicine Licensure Clarity Act would ensure that team doctors, trainers, and other licensed healthcare professionals are covered by their malpractice insurance when providing care to their athletes outside of their primary state. Special Needs Trust Fairness Act would extend the Special Needs Trust exception to allow non-elderly folks with disabilities to establish a special needs trust on their own behalf. If enacted, special needs trusts established by a non-elderly disabled individual would no longer be considered an asset in determining that individual's eligibility for Medicaid. Have an amendment in the nature of a substitute for the bill, which will include 2 very targeted policies. One, which would require a more, no, we're not going to do that. So one would extend the Medicaid's tobacco cessation benefit to women for the first day of their baby's life. Overall, the accrued savings will be deposited in the Medicaid Improvement Act. And lastly, we'll consider the Strengthening Public Health Emergency Response Act of 2016, which would examine how we can improve our emergency preparedness programs better, coordinate our strategic national stockpile, and create a new priority review voucher program for incentivizing medical countermeasures to ensure that our nation is prepared in the event of an attack. Look forward to advancing all these important bills. Recognize the gentleman from New Jersey for an opening statement for 5 minutes.
Thank you, Mr. Chairman. This is our last chance to move meaningful legislation through the committee process before the extended July-August recess. Unfortunately, instead of working together to help our constituents, we're faced today with a majority's systematic attempt to dismantle the one agency, the Federal Trade Commission, whose mission is to protect consumers from unscrupulous actors in the marketplace. The GOP's process bill, H.R. 5510, does not help innovation. Instead, it makes consumers less confident that they are being protected and therefore less likely to trust the newest technologies. This morning at our FCC oversight hearing, I pointed to a recent study by the National Telecommunications and Information Administration that found 84% of Americans are worried about their privacy and security online. Half of the households surveyed are so worried about their privacy that they limit their online activities. And it's not only Democrats who have voiced concern. Last month, at a hearing on privacy and Internet service providers, the lead Republican witness raised concerns about this bill. That hearing also highlighted the majority's unique ability to speak out of both sides of its mouth at the same time. During the hearing, I heard my Republican colleagues and the Republican witnesses continually praise FTC's enforcement and oversight. Now this month, the majority seeks to move a bill that undermines the FTC's enforcement abilities. It's ironic that my colleagues would praise the FTC and its expertise while at the same time advancing a bill through the committee that would cut the FTC's legs out from under it. The Republican process bill before us today would gut the FTC of even its limited authorities. Among its numerous deficiencies, this bill would weaken FTC's major enforcement tool by capping consent orders at 8 years. It would also create major loopholes that allow bad actors to avoid enforcement by relying on outdated or irrelevant guidance or by using stall tactics to force automatic closures of investigations. Mr. Chairman, marking up this bill today is frankly a waste of time. We should be focusing on bills that have bipartisan support and can be signed into law, not those that are election year schemes that may not make it to the House floor, let alone make it through the Senate. Today, we're also considering 7 other bills, including H.R. 5111, the Consumer Review Fairness Act, a bill that would protect the free speech of online reviewers, and I support this bill. Companies should not be including non-disparagement clauses in their terms of service agreements. I also support H.R. 5104, the Better Online Tickets Act, that prohibits bots, sophisticated ticket buying software that can buy up hundreds of tickets in a matter of minutes or even seconds, long before a consumer even gets around looking at the ticket selling website. However, as we heard in testimony, bots are only a small part of the ticketing challenges facing consumers, and that's why I supported moving Mr. Pascrell's better oversight of secondary sales and accountability in concert ticketing, or the BOSS Act, which seeks to address a number of transparency issues. Regarding H.R. 5092, the Reinforcing American-Made Products Act, I am sympathetic to the calls for a national standard for what is made in the USA, but I do not want to diminish state enforcement tools, and therefore I can only support final passage if it includes the amendment that Mr. Kennedy will offer to ensure that states can enforce the national standard. We're also considering H.R. 1301, the Amateur Radio Parity Act. Amateur radio provides essential services in times of emergency. I support the bipartisan amendment, the nature of a substitute negotiated by Chairman Walden and Ranking Member Eshoo. It addresses concerns raised by stakeholders while providing amateur radio services with better access to build facilities. As to the health bills, while I support the intent of H.R. 3299, I have serious concerns about creating a new permanent priority review voucher program absent evidence that this incentive is needed or works. GAO has conducted only one study of an existing priority review voucher program. To date, we've not seen evidence that the program works as intended, but we are aware of serious and unresolved issues with existing PRV programs. These issues have allowed certain manufacturers to receive this valuable incentive without any new research or the requirement to make the product available to those in need. Making such an incentive permanent will only perpetuate known failures in existing PRV programs. It will also further devalue the incentive for other important development areas such as neglected tropical and rare pediatric diseases. I also have concerns with delegating contracting authority directly to the BARDA director. As the acting BARDA director made clear at the hearing, the data does not support the need for this change, and this structure raises program integrity issues. I support H.R. 929, the Sports Medicine Licensure Clarity Act, that will ensure that sports medicine professionals are covered by their liability insurance while they're traveling with their teams. This is a common sense bill that solves a problem unique to sports medicine professionals since they travel around the country with their teams. The bill does not allow those providers to practice beyond the scope of their license or to treat athletes off the field. I'm pleased that the sponsors are able to work with the committee and stakeholders to ensure that the bill achieves the right balance. And finally, H.R. 670, Special Needs Trust Fairness Act, is bipartisan legislation that would allow individuals to set up special need trusts for themselves without a court petition. This is also a common sense policy that will help individuals with disabilities. I've championed this legislation for multiple Congresses and believe that it should be enacted into law. However, this bipartisan bill has been amended by policies that have not been considered by our members, and this is not transparent and circumvents a process that is in place for a reason. I do not believe these policies have been thoroughly reviewed, and therefore I simply cannot vote in favor of this legislation moving forward if these extraneous policies are adopted, and I hope we can work together to make the necessary changes. Thank you, Mr. Chairman.
Thank you. Are there other members wishing to make an opening statement? The gentleman from New Jersey is no? The lady from California is recognized for 3 minutes.
Thank you, Mr. Chairman, and thank God everything is all right. And lockdown is over without any incident. I appreciate you calling this markup on the several bills that we're taking up to address the authorities and the processes of the Federal Trade Commission, legislation on amateur radio parity, as well as legislation to strengthen our biodefense. I have a keen interest in that area, having authored the original legislation, which became law with Richard Burr, and it's been a pleasure to work with my colleague from the other side of the aisle, Susan Brooks, on this to bring it up to date. I welcome the committee consideration of H.R. 5111, the Consumer Review Fairness Act. This is going to prevent businesses from trying to silence their critics online on online review websites. It's an important bill that I hope everyone will support. However, honest reviews can be silenced through other types of lawsuits that are not covered by this bill. That's why I've authored broader legislation called the Speak Free Act to crack down on meritless lawsuits that are intended solely to silence critics. These lawsuits threaten the First Amendment and open communication on the internet. My hope is that the Speak Free Act will move jointly with the bill before us today. I'm also pleased we've reached an agreement on the Amateur Radio Parity Act. This bill will make it easier for amateur radio operators to install the antennas they need to broadcast over the air, while also providing homeowners associations with the flexibility to establish reasonable rules regarding the size and the appearance of these antennas. I'm pleased to have worked on the substitute amendment sponsored by Chairman Walden, Kinzinger, and myself, and I think it's a good example of a bipartisan compromise and cooperation, and I think that we've done a good job on that. I do have concerns with H.R. 5092, the Reinforcing American-Made Products Act, because the bill would undermine California's very strong made in the USA labeling law, which is really the gold standard in our country, and it's synonymous with safe and quality made products. So I really strongly oppose any preemption of California's laws, and in this case, California has a superb one. I'm also disappointed that the committee has chosen to move forward with the FTC Process and Transparency Reform Act because it weakens and undermines the FTC's authority to protect consumers under the guise of process reform. It's no coincidence that the majority has advanced legislation to transfer broad consumer protection authority from the FCC to the FTC, while simultaneously working to gut the FTC's ability to enforce these vital protections. So this is a little bit of agency cross-dressing here. So I can't support that. But finally, Mr. Chairman, I want to thank you for your leadership in bringing up H.R. 3299, and that's the Strengthening Public Health Emergency Response Act. We all know that as members, our highest responsibility is the national security of our nation, and this includes biodefense. This bill makes critical updates to the Biomedical Advanced Research and Development Agency, which we call BARDA, the procurement of medical countermeasures, which will provide Congress with the useful information on state, local, and hospital preparedness programs, and review voucher programs at the FDA, and creates a new incentive program to encourage the development of medical countermeasures. And we absolutely need to do that. These efforts that my colleague, Mr. Pallone, mentioned, really, if you vote for those, you're going to be gutting the bill, absolutely gutting the bill. And I don't know why they're having a problem with it I think it's just a tug-of-war inside of a small agency. At any rate, I want to especially thank my colleague, Ms. Brooks, and her staff. They've been just absolutely terrific to work with, serious-minded, important contributions, tireless efforts in moving the bill to the finish line. So thank you, Mr. Chairman, and I yield back.
I thank the gentle lady. The chair reminds members that pursuant to the committee rules, all members' opening statements will be made part of the record. Are there further opening statements? Mr. Bilirakis.
Thank you, Mr. Chairman. And I want to thank Chairman Upton for holding this very important markup. Today we consider 8 bills that will benefit our seniors, consumers, and businesses across the nation. I'm especially proud we will consider my FTC Reports Act as part of the larger Federal Trade Commission Process and Transparency Reform Act. This bill will bring about a more transparent and accountable FTC, a goal this committee has had for a long time. My FTC Reports Act would require the Federal Trade Commission to submit an annual plan to identify projected activities, including policy priorities, any rulemakings, plans to develop guidelines, efforts to restructure the Commission, and activities related to the Commission's efforts to combat fraud against individuals over the age of 65. By requiring annual reports from the FTC, we may better identify areas of potential reform and ways we can help protect consumers, especially seniors. There have been far too many cases of exploitation of our elderly. Many of my constituents have fallen victim to fraudulent behavior and scams. According to the National Adult Protective Services Association, an estimated 1 in 5 adults over the age of 65 have reported financial exploitation. Moreover, only 1 in 44 cases of financial abuse were reported to the authorities. Unfortunately, these bad actors target our nation's seniors, and the results can be devastating to these individuals and their families. The Federal Trade Commission must work to better address this problem. The legislation before us today gives us the opportunity to help improve and modernize the FTC. These bills will provide certainty for all Americans. My bill helps to better protect our seniors and their families, and I'm proud to continue working to empower our consumers. I want to thank Chairman Upton again and Chairman Burgess for including my bill in the larger Reform Act, and I yield back. Thank you.
Thank you very much, Mr. Bilirakis. The chair now recognizes Mr. Tonko of New York.
Thank you, Mr. Chair. And I rise in strong support of H.R. 5104, the Better Online Ticket Sales Act, better known as the BOTS Act, on which I joined in introducing with my colleague and good friend from Tennessee, Mrs. Blackburn. This bill would target the unfair practice of using software bots by scalpers to automate the process of purchasing event tickets from online vendor platforms. As was amply demonstrated at the legislative hearing, the current lack of any federal statute to deter the practice of using bots has turned the ticket industry in the United States into a fixed game. For instance, on December 8th of 2014, a single broker used a bot to purchase over 1,000 tickets for a U2 concert at Madison Square Garden within the first minute of sales. By the end of that day, the same broker and one other had amassed more than 15,000 tickets to U2's shows across North America. According to an exhaustive investigation by New York State's Attorney General Eric Schneiderman, tickets that are purchased in this manner are then resold on secondary markets at an average of 49% above face value, though there are plenty of examples where the markup was more than 1,000%. The people in the capital region of New York that I represent and those across the country work too hard to save enough money to see a performance or a game. They shouldn't be prohibited from buying a ticket online because a computer program beats them to the punch. By following the example set by states like New York, where unlawful ticket brokers have had to pay stiff penalties for their actions, we can start to reel in these unfair practices. The BOTS Act takes a cue from my home state by prohibiting the intentional use or sale of bot software, as well as barring any knowing sale or use of tickets acquired by bots for entry into a concert or event. This legislation would establish civil penalties for this behavior on a national level, instructing the FTC or the Attorney General of a state to bring civil action against any person found in violation. There is clearly still much that can be done to protect consumers within the ticket market, but I believe the BOTS Act represents an excellent first step in bringing this industry out of the shadows and holding shady ticket brokers accountable for their actions. With that, I thank you, Mr. Chair, and I yield back the balance of my time.
Thank you, Mr. Tonko. I'm advised that Congresswoman Brooks wishes to participate, and she is on her way and is slightly delayed because of the lockdown, and we will pause to wait for Congresswoman Brooks of Indiana. And then that will be it. Or so I'm advised. Thank you very much. The hearing will reconvene, and the chair recognizes Congresswoman Brooks from Indiana.
Thank you, Mr. Chair. I want to thank you for the indulgence of waiting a few moments. First of all, I want to thank Chairman Upton for his dedication in recognizing this matter as a priority and his dedication to craft policy that will benefit public health in the face of biological threats that occur in nature as well as those being manufactured by terrorist groups. Also want to thank my partner on this bill, Congresswoman Eshoo, who as the author of the original Project BioShield in 2006 brings a wealth of experience and insight that demands our utmost respect. Mr. Chairman, to illustrate the problem that we face, let's consider a group of 20 people. In the event of an outbreak of smallpox, 6 out of the 20 will die. If a terrorist group attacks the 20 people with nerve agents, 13 will perish. If the 20 people were infected with Ebola, 18 would lose their lives. And if a cyanide or multi-drug resistant anthrax attack, it would leave all 20, the entire population, dead. When faced with threats like these are only a few of the 13 deadly pathogens considered material threats by our U.S. national security community. We are in very real danger because because of all of these threats, we are woefully unable to handle these types of threats. Like many of my colleagues here today, I believe that Congress's top mission, and one which I pledged to uphold earlier in my career when I was appointed as U.S. Attorney and sworn in after 2001, it is our duty to defend our country against all threats, foreign and domestic. When crafting those words, our founders couldn't have imagined the world we live in today where entire populations could be wiped out by threats invisible to the naked eye, made by their fellow man and able to be transported around the world in a matter of hours. The bill before us, H.R. 3299, takes significant steps to strengthen our underlying emergency preparedness enterprise by coordinating our medical countermeasure stockpiling efforts, reforming contracting procedures at BARDA, creating a new priority review voucher program for these material threats. Returning that contracting authority to BARDA, as is intended in statute, will ensure faster development of critical medical countermeasures, strengthen our relationship with private sector partners, and cut through bureaucratic red tape without creating new burdens for HHS or costing taxpayers a dime. Creating a new priority review voucher program for agents and deadly pathogens identified on the DHS material threat list will spur innovation and the development of effective medical countermeasures. This is vital because there is not a commercial market for these vaccines and treatments, and thus little incentive for private industry to invest in researching, developing, and manufacturing these medicines. This bill fixes that by creating a true incentive for our private sector partners to develop medical countermeasures without adding to our deficit. Legislation authored by Senators Burr and Senator Casey closely mirrors H.R. 3299. It's already passed out of the Senate Help Committee with full bipartisan support. This is not now and has never been a partisan issue, and I'm so very pleased that the committee will be taking up this important legislation. With that, I urge my colleagues to support this legislation and yield back.
Thank you very much. Are there other members who wish to speak opening statements? Seeing no one, this concludes the opening statements. The committee will reconvene tomorrow at 4:30 in the afternoon, not 2 o'clock, and I remind members that the chair will give priority recognition to bipartisan amendments. I look forward to seeing all of you tomorrow. Without objection, the committee stands in recess.